Random samples are harder to get, but the results are generalizable to a larger population. One of the simplest forms of random sample is called the simple random sample. It means that each person in the population has an equal chance of being selected to be in the research. You have all the bachelor degree students in nursing. That's your population. Everybody who's in a bachelor's program has an equal chance of being in the study. Quite often we're looking at a random numbers table, or we're looking at drawing names out of a hat. This works best if the population being studied is small and self-contained. If you're studying all African Americans, the number is so large, how are you going to be able to truly randomize them? How are you going to be able to truly use a table of random numbers? Now, yeah, granted, now we've got computers that can help us with this, but it's a tough task. Plus, the African Americans are scattered thousands of miles apart. How are you going to get to them? But you could randomly select from the African Americans in Dover, Delaware. The population would be African Americans in Dover. You could generalize your results to that population and be confident. You would not be nearly as confident about generalizing the results to African Americans in Hawaii, though. Okay, a stratified random sample. A representative number of subjects from various subgroups is randomly selected. Suppose we want to study the percentage of nurses who have children below the age of 18 in the city of Dover. But perhaps the type of job the nurse has is correlated to the age of her children. Wouldn't you think that nurses who have young children might be more likely to be school nurses so that their schedule is similar to that of their children? So, for this study, we identify the types of jobs we wish to pull the data from and assign a percentage to each. We decide that 10% of the sample should come from public or community health nurses, and 2% should be from school nurses, and 40% should be from med-surg nurses, etc. We've gone down and we've looked at all the different types of nurses, and we've assigned a percentage for what we want our final sample to look like. So we find a list of all the nurses and their specialties, and we divide the names into the groups, and then we randomly select from each of these pools, until we get 40% of our final number that's coming from med-surg and 10% of our final number that's coming from public and community health nurses. So we do have some randomization going on, but we've also predetermined how many people from each category we're going to end up with. A systematic random sample, say you have a list of 10,000 names from a national group of nurses, and using random numbers would be unmanageable with this group, but it would be much easier to take every 25th name on the list. If you keep using the system, you're going to achieve the same results as a simple random sample. A cluster sample. If you want to study all the pediatric nurses in New York who work in hospitals, it would be very costly and time-consuming. You can't visit all the hospitals. But you could take the names of all the hospitals and randomly choose, say, 10 of the hospitals. Then, you know that each hospital has an equal chance of being chosen. Then within each hospital, you randomly select nurses. So you have randomization going on in this system. Randomness. All of these that I've talked about utilize randomness. You can use a higher level of statistics and be sure of the results with them. The ones that are now coming do not have the same level of external validity because that we're not using randomness. A convenience sample. You collect data on anyone who fits the study parameters and can be found. We survey the nurses who are just in one unit, or we take anybody who walks in, that kind of a thing. There's no randomness to this whatsoever. We can get higher numbers because we're just taking anybody we can get, but there's no randomness to this. A purposive sample. We intentionally try and get people who have a particular trait or have had a particular experience. For instance, you go after people who you know have had testicular cancer. We look specifically for them. Or we go to one hospital because we know it's got a great track record for retaining nurses, and we survey the staff and administration at that hospital. A snowball sample is often used in qualitative research. We find participants through other participants. We interview a few women who are from Iran and have given birth in the United States. Through these women, we can identify other women who are from Iran and have given birth in the United States. It is a word-of-mouth type of finding participants. It's networking. It's like a snowball rolling downhill, gaining size as it goes along.